Revenue and Customer Experience, and Dr. Sandra Primiano, psychologue, vice-présidente PAEF et service de counseling. From Kids Help Phone, Jeunesse J'écoute, Alissa Simon, Executive Vice President, Chief Youth and Innovation Officer, and Andréane Deschamps, vice-présidente associée au programme de ce même organisme. Today's event will begin with remarks from Minister Bennett, followed by remarks from the Wellness Together Canada Consortium Executive Leadership. There will be a media Q&A session at the end of the event. Nous tiendrons une séance de questions et réponses avec les médias à la fin de notre événement. Media wishing to ask a question can do so by using the Raise Your Hand feature. Once again, thank you for joining us today. Now, let's turn our attention to our first speaker, the Honorable Caroline Bennett. Encore une fois, merci d'être des nôtres aujourd'hui. Maintenant, écoutons notre première conférencière, l'Honorable Caroline Bennett.
Merci, Elisabeth. Good morning, everyone. Je me joins à vous aujourd'hui du territoire traditionnel des Mississaugas of the Credit, où nous honorons tous les peuples autochtones qui ont pagayé ces eaux et dont les mocassins ont parcouru ces terres. Thank you all for being here. I am truly honored to be here with these mental health leaders, step care legend, Dr. Peter Cornish and Dr. Alexia Jawish, Sean Slater and Dr. Sandra Primiano from Homewood Health, and Elisa Simon and Andréane Deschamps from Kids Health Phone. As we all know, these past 2 years have been extremely difficult. Omicron has inflicted another blow, and we need all Canadians to respond by getting vaccinated and following their local public health advice. Depuis 2 ans, nous avons dû répondre à des perturbations sociales sans précédent. La perte d'êtres chers, l'inquiétude pour le bien-être de nos familles et amis. It's not surprising that so many Canadians are reporting an increase in feelings of stress, sadness, and loneliness. And half of all Canadians report that the mental health has gotten worse since the beginning of COVID-19 pandemic. Canada is facing a parallel pandemic of mental health problems, increasing substance use, and deadly toxic drug supply. In 1954, Dr. Brooke Chisholm, a Canadian psychiatrist, World War I vet, and the first Director General of the WHO, said, "There can be no health without mental health. Mental health is health." He had been Canada's first Deputy Minister of Health in 1944. COVID has taught us that indeed, there can be no health without mental health. Comme plusieurs le savent, j'ai atterri par accident en politique après avoir lutté pour l'indépendance de Women's College Hospital de Toronto pour protéger sa capacité d'innovation et répondre aux besoins de ses patients. I've been struck by the parallel with the fight for Women's College Hospital in downtown Toronto. In 1990, it was about protecting the future of health and healthcare. The shift from doctor-centered to interdisciplinary care, from a focus on hospitals to care in the community, where the patient is a true partner in their care. In 1990, we were fighting for providing trauma-informed, culturally safe care with a focus on the social determinants of health, poverty, violence, the environment, shelter, equity, and education. En travaillant avec les provinces, territoires, municipalités et le leadership autochtone, experts et ceux ayant une expérience vécue ou vivante, nous construisons un élan pour augmenter la connaissance sur la santé mentale de tous les Canadiens. Nous souhaitons atteindre l'équilibre du cercle d'influence mentale, émotionnelle, spirituelle et physique. We recognize that we need to ensure the most appropriate and timely care by the most appropriate provider in the most appropriate place including the virtual care that COVID has accelerated. As a daughter, mother, daughter-in-law, friend, family doctor, and parliamentarian, I know how devastating mental health issues can be to patients and their families. I also know how important it is to reach out to people and meet them where they are, to let them know that they are not alone. Young people, the 2S LGBTQIA plus community, and people from marginalized communities have not been well served. People are suffering. We can no longer expect Canadians to adapt to systems that are not working for them. The systems have to change to meet the needs of Canadians. As was declared in the Ottawa Charter for Health Promotion in 1986, we need to change our health care systems into systems for health. From the start of the pandemic, we knew it would be important to provide mental health and substance use supports to people who couldn't access services due to pandemic disruptions. And we knew there would be people looking for support and not knowing where to find it. In April 2020, with the support of the Government of Canada, a consortium of leaders in digital mental health, some of whom are here today, and substance use support, including the Step Care Solutions, Kids Help Phone, and Homewood Health, came together to launch Wellness Together, an online portal that provides free 24/7 access to mental health and substance use supports. The response has been incredible. An average of 20,000 to 30,000 people in Canada turn to Wellness Together Canada for mental health and substance support each week. And to date, over 2 million Canadians have already accessed the site. Il est clair que ce service était nécessaire pour les Canadiens qui avaient besoin d'un appui en santé mentale durant la pandémie. But still not enough Canadians even know about it. We know that we need to do more. In building back better after COVID-19, we need to ensure that supporting the mental health of Canadians becomes part of the new normal. Wellness Together has become an important evidence-based tool in mental health support and navigation to help those who are struggling. A user survey indicated 73% believed that they would use the service more frequently if an app was available, and 85% said they could benefit from an easy way to track their mental well-being. So today, we together are announcing the launch of PocketWell, a free companion app to Wellness Together Canada. Canadians can use this app to complete self-assessments and track their mood and mental well-being. Grâce à Mieux-être, les gens à travers le pays peuvent se connecter sans effort à l'espace Mieux-être Canada, gratuitement et confidentiellement, à des sessions virtuelles avec des travailleurs sociaux, psychologues et d'autres professionnels de la santé mentale et de la consommation de substances depuis leur téléphone ou autre appareil. Having this app also available 24/7 to complement the Wellness Together portal provides yet another tool to help improve access to available mental health and substance use resources for all Canadians. Almost half of the Wellness Together users are between 19 and 29 years of age, an age group that tends to see a higher prevalence of mental health and substance use related conditions, yet have lower use of traditional mental health and substance use services. The PocketWell app will better serve this age group, reaching them where they are with a direct link through their mobile devices. Because we also recognize that registered users are accessing the portal through their mobile device almost already 71% of the time, this app will make that access much easier. Durant cette période incertaine, il est important que les Canadiens aient accès à des ressources efficaces et à un soutien en santé mentale et en consommation de substances quand et où ils en ont besoin. While COVID-19 has indeed been challenging, it also seems to have made it easier for Canadians to admit when they are struggling. We are all seem to be more comfortable talking about mental health, mental illness, and problems with substance abuse. substance use. But I believe this change will help to reduce the stigma that still remains a barrier for those who are suffering to reach out for help. C'est OK de demander de l'aide. Il est impératif que nous rejoignons ceux dans nos vies qui peuvent souffrir en ce moment. Il est important que nous soyons là pour eux, mais que nous suggérions aussi qu'ils rencontrent leur médecin de famille ou infirmière praticienne. We hope that you will also suggest that Wellness Together app, PocketWell, could be helpful and provide support 24/7 for free, evidence-based information and supports. Thank you. Merci, Miigwech.
Thank you, Minister Bennett. I would now like to welcome Dr. Peter Cornish and Dr. Alexia Jawish from Stepped Care Solutions to say a few words.
Thank you. It's my pleasure to speak today about Wellness Together Canada, especially as Minister Bennett is indicating, we are still very much in the pandemic, and the recent surge is ever more more and more evident to everybody. We're not out of it yet. Some of my colleagues have been predicting in the mental health field that we will soon see what is referred to as an echo pandemic around mental health. And I do think that there's a good news and a bad news story here, that we now are hearing people being much more interested in mental health, and that's good news. That means that people are ready to do something, ready to talk about it, ready to access programming. They often don't know where to turn, and so we do have a mental health crisis emerging, but it's more of a crisis of supply and access. And so if people know where to go and we can increase the supply, then I think we can really mitigate some of the challenges that we're seeing ahead around mental health. People are struggling with isolation, financial uncertainty, and the complex challenges brought about by disruptions to daily routines, such as school, workplace closures, daycare. When the daycare closes, how do you work? How do you work at many people are saying working at home is wonderful, but it can be very complicated, particularly when childcare is right there in the room with you. Particularly when I'm talking to some of the clients that I see, mothers, single parents, it really is a challenge. So through Wellness Together Canada and the new PocketWell app, it will be easier for people to get their mental health wherever they are. If they're at home, if they're walking down the street, if they're in a cafe, they can privately browse through these curated tools and access a buffet of options. And really what we envision with Wellness Together Canada is that people can choose from this buffet things that they're ready to use right now. Some people are ready to use to connect with a counselor. What we've discovered through the launch of Wellness Together Canada, many people, first of all, just want to check things out. They want to learn a little bit more, or perhaps they want to practice and try some things on their own. So this is free mental health support for all peoples of Canada, 24/7, no matter where they live, how old they are, no matter how well or how sick they are. This is available for everyone. And just like what we hope to achieve with your primary care physician, although there are some places in the country where it is difficult to get a physician, the idea is your physician is there for you no matter what you need. And what we're trying to do with Wellness Together Canada is this is for everyone. With over 2 million unique visitors, we see how this is meeting an urgent need, and our aim is to help even more with today's announcement. What really differentiates Wellness Together Canada and the PocketWell app is the use of what we call a stepped care model. an innovative, it's actually a different version made in Canada of Step Care that we call Step Care 2.0, that is really aimed at having consumers make the decision and have the choices about what works best for them, with assistance from experts that can guide those choices. So it's preference-based rather than somebody tells you this is what you should do. You can obviously ask for advice on what would be best for you, but we like to start first with what are Canadians ready for. And so what it ensures is that every individual can access the level of care most appropriate to their unique needs when managing their mental health or substance use. So it includes research-based tools to help users better understand their mental wellness, using assessments developed by psychologists, and using self-guided mental health and substance use resources. There's also the ability to connect immediately with trained counselors and crisis responders from Homeward Health and Kids Help Phone. And there's an option to connect with your peers, peer support. Many people find that it might be easier to talk with people who have been where they've been. And so that's a really important feature of Wellness Together Canada that may not be available in other places in your community. There's one thing that we want people to remember across Canada is that you're not alone. The peer support programming is geared towards that reality, and the whole buffet of options for connecting helps people to work on this either together. Sometimes people prefer to work on it one-on-one, and we have all those options. Free virtual support is just a click away, no matter what time of day or night. So Alexia, I think, are you up next?
Yes, thank you. Bonjour à tous. Et comme l'a dit Dr. Peter Cornish, le Canada doit continuer de composer avec la pandémie du COVID-19, qui n'est pas seulement une crise de santé publique, mais aussi une crise de santé mentale. Les défis complexes découlant des perturbations de la routine quotidienne, comme les fermetures des écoles et des milieux de travail, sont source de problèmes d'isolement et d'incertitude pour un bon nombre de personnes. Grâce à Espace Mieux-être Canada et maintenant à l'application Mieux-être, tous au Canada ont accès en tout temps à des services de soutien en santé mentale gratuits, et ce, peu importe où ils vivent et peu importe leur âge. Le portail, qui a déjà été consulté par plus de 2 millions de visiteurs uniques, répond à un besoin urgent. Et avec l'annonce d'aujourd'hui, nous espérons aider encore plus de gens. Espace Mieux-être Canada et l'application Mieux-être font appel au modèle de soins par palier, une approche novatrice en matière de soins de santé mentale qui veille à ce que toutes les personnes puissent accéder au niveau de soins qui convient le mieux à leurs besoins uniques. Cette solution comprend des outils fondés sur la recherche pour aider les utilisateurs à mieux comprendre leur santé mentale à l'aide d'évaluations qui sont mises au point par des psychologues, ainsi qu'une gamme de ressources au sujet de la santé mentale et de la consommation de substances. Les utilisateurs peuvent également immédiatement échanger avec des intervenants et des répondants qui sont formés à répondre aux crises. Ces professionnels œuvrent au sein de Homewood Santé et je les écoute. Les utilisateurs peuvent se confier et discuter de ce qu'ils vivent par téléphone ou par texto dans le but d'obtenir l'aide dont ils ont besoin. Ce que nous voulons avant tout, c'est que tous au Canada, d'un océan à l'autre, sachent qu'ils ne sont pas seuls, qu'il ne suffit que d'un clic ou un appel pour obtenir gratuitement de l'aide de jour comme de nuit. Merci.
Thank you both. I now invite Mr. Sean Slater and Dr. Sandra Primiano from Homewood Health to say a few words.
Good morning, and thank you. We've all seen firsthand how COVID-19 and other mental health challenges have touched every community in Canada. Well, mental health services are experiencing an unprecedented increase in demand. With the support and the funding of the federal government, Homewood Health, Kids Help Phone, and Step Care Solutions have brought to life a Canadian-made, innovative approach to providing access to virtual care for mental health challenges. By bringing three of the leading organizations in mental health in the country together to collaborate, Wellness Together Canada is relieving pressure on other mental health services across the country. On behalf of our partners, I'd like to thank and acknowledge the Government of Canada for their commitment to supporting the mental health of all people by their continued funding of Wellness Together Canada. We will continue to support people who need help when they need it, and with this app, expand to reach even more people in need. Anecdotally, I just wanted to share one little piece of information. One of the most surprising things that I have found in the last almost 2 years of Wellness Together Canada is that when people phone and they're looking for counseling, they're most surprised that they're able to receive it immediately. And many of them are not ready for a session of counseling right now. They haven't taken steps to have childcare for their child, or they're calling on a break from work. They're just not expecting to have counseling right away because that's not what the system has sort of set up for them in the past. So we're kind of adding a whole new dimension of availability for folks who are seeking out help, and really being there for them when they need it and when they want it. Multiple mental health services, including this live counseling, are now available at the touch of your mobile device for free with the PocketWell companion app. So I encourage you to download the app and try it out. It's available for iOS and for Android through the usual app stores. So thank you very much, and I'll pass it over to Dr. Sandra Primiano.
Merci, Sean, et bonjour à tous. Alors, nous sommes directement témoins de la façon dont la COVID-19 et les difficultés en santé, matière de santé mentale touchent toutes les collectives au Canada, alors que les services de santé mentale partout au pays sont sollicités comme jamais auparavant. C'est vraiment avec l'aide et le financement du gouvernement fédéral que Homewood Santé, Jeunesse, J'écoute et Step Care Solutions ont donné vie à une approche novatrice, entièrement canadienne en matière de prestation de soins de santé mentale virtuelle. C'est en réunissant ces trois organismes de santé mentale de premier plan, Espace Mieux-être Canada comble les lacunes et atténue la pression que subissent les autres services de santé mentale. Alors, nous voulons reconnaître et remercier le gouvernement du Canada qui s'est engagé à soutenir la santé mentale de tous les Canadiens en finançant Espace Mieux-être Canada. Nous continuons de soutenir les Canadiens au moment où ils auront besoin et grâce à cette application, pourrons même élargir nos services afin de rejoindre encore plus de personnes. Alors, plusieurs services et mesures de soutien en santé mentale, y compris des services d'intervention en direct, sont maintenant offerts gratuitement sur votre téléphone cellulaire grâce à cette application complémentaire Mieux-être. Alors, on vous encourage à franchir le pas et à télécharger l'application qui est offerte pour iOS et Android sur les boutiques d'applications. Et je vais passer la parole à ma collègue Alissa.
Merci d'abord à vous deux. Maintenant, accueillons Alissa Simon et Andréane Deschamps de Jeunesse J'écoute, Kids Help Phone. Mesdames, à votre tour de nous adresser quelques mots.
Thank you so much. So 2 years ago today, Kids Help Phone was the only 24/7 free bilingual e-mental health resource in Canada. And 10 to 15% of our interactions were with adults because they had no place else to go. And so when the COVID-19 pandemic hit, the federal government recognized that immediate support of people in Canada was needed, and they enabled the launch of Wellness Together Canada. You've heard we are a 24/7 free bilingual national e-solution for mental health and substance use. And it is the first of its kind in Canada and also across the globe, where we support people of all ages. So we are gathered here today to celebrate the continuum and growth of the Wellness Together Canada platform, to launch our PocketWell app, to make mental health and substance support more accessible to people of all ages in every province, in every territory. Through the app, individuals can access free support for mental health and substance use in both French and in English, and they can do it immediately, day or night. Our aim with this app is to help even more people beyond the 2 million individuals to date in order for them to get the mental health and substance support they need and when they need it most. So on behalf of the joint venture partners, we want to extend a heartfelt thank you to Minister Bennett, to Minister Duclos, the Prime Minister of Canada, and to everyone at Health Canada for making this life-saving portal and now app a reality. We are all hoping that the end of the pandemic is hopefully in sight, but we know that the tail end of this pandemic is going to be mental health and substance use. And Wellness Together Canada and the PocketWell app will be there to support people across Canada throughout, thanks to the Government of Canada. So thank you very much, and I will pass it to my colleague, Andréan.
Merci, Alissa. Il y a 2 ans, Genève J'écoute était la seule ressource pan-canadienne gratuite, bilingue, ouverte 24 heures sur 24, qui offrait des services virtuels en santé mentale. Même si Genève J'écoute est une ressource en fait pour les jeunes, environ 10 à 15% des utilisateurs étaient adultes, car il n'y avait aucune autre ressource de comparable pour eux. Dès l'arrivée de la pandémie, le gouvernement canadien a rapidement mobilisé une réponse d'aide en santé mentale et a soutenu le lancement d'Espace Mieux-être Canada, qui est une solution numérique et nationale en matière de santé mentale et de consommation des substances. Unique en son genre au Canada et même à travers le monde, les services sont bilingues, accessibles 24 heures sur 24 et 7 jours sur 7, vraiment en tout temps. Aujourd'hui, nous célébrons la croissance d'Espace Mieux-être Canada avec le lancement de l'application mobile Mieux-être. Les services d'aide sont maintenant beaucoup plus accessibles. Elle est également disponible en français et en anglais et elle est conçue pour tous les âges et permet d'obtenir gratuitement et en tout temps du soutien en santé mentale. À ce jour, plus de 2 millions de personnes ont reçu du soutien offert par l'Espace Mieux-être Canada. Avec la nouvelle application mobile, nous souhaitons aider encore plus de gens à obtenir de l'aide en santé mentale au moment où ils en ont besoin. Tous les partenaires tiennent à remercier chaleureusement la ministre Bennett, le ministre Duclos, le premier ministre du Canada et toute l'équipe de Santé Canada qui ont permis à l'Espace Mieux-être et à la nouvelle application lancée aujourd'hui d'exister et de soutenir la population comme nous le faisons depuis 2 ans. Nous savons déjà que la santé mentale et la consommation des substances sont encore des enjeux importants et ce, même en fin de pandémie. Espace Mieux-être Canada et l'application Mieux-être seront là pour soutenir les gens à travers le pays et ce, grâce au généreux soutien du gouvernement du Canada. Merci.
Merci, mesdames. Ceci met fin à la partie protocolaire de notre conférence de presse. Thank you to Minister Bennett and all our guest speakers. I would now like to turn to Maya Staka for the media Q&A portion of the event.
Hello, everyone. So thank you so much, Parliamentary Secretary Briere. Merci beaucoup. So before we proceed to the media Q&A session, I just want to go over some preliminary details. Media wishing to ask a question can do so by using the raise your hand feature. Once I call on you to ask a question, I will unmute you. Please let me know your name and media outlet, who your question is directed to, and then ask your question. You can ask one question and one follow-up, and if time permits, you can join the queue again. If you have any further questions or any technical difficulties during this Q&A, please contact Health Canada and the Public Health Agency of Canada Media Relations Team at 613-957-2983. À tous les conférenciers, merci pour vos observations. Nous procéderons maintenant à la séance de questions-réponses des médias. Ceux qui souhaitent poser une question peuvent le faire en utilisant la fonction lever la main. So, let's begin. I see a few hands up. Wyatt Sharp, you can begin.
Hi there. Sorry, thank you. Wyatt Sharp, the Wyatt Sharp Show. My question is for Minister Bennett, but I suppose anyone else can touch on it. It was briefly mentioned, but just speaking a little bit more about the logistics of it for people who are, watching this announcement at home today and are wondering, when this might come into effect, when they'll actually be able to download the app. Is there any details as to what sort of system they might need, or is it going to be available on both Android and Apple? Just kind of the availability of it, if you could speak to that.
I'm happy to just begin, but I think the experts are the ones that will be better able, but it is now at the Apple App Store and Google Play Store, and it is accessible on both Android and other platforms. So it's we hope it will meet the needs of everyone as they go forward. But maybe who would like to just do the granular details there for Wyatt? Great picture, Wyatt.
Yes. So Wyatt, it is available now. It's live now. It's been live for a few days, but today's the official announcement. So it's up and ready and working. If you just search for PocketWell, you should find it, either Android or iOS.
Okay, thank you. That's all. No follow-up.
Perfect. So Fraser Needham, you're up next.
Hi there. Can you hear me okay?
Yep.
Good. Yep. Thanks very much. So question, I guess this question is for the minister, actually, but others feel free to answer as well. We're the work for APTN here out of Ottawa, but we've been following the Bearskin Lake crisis and other communities up north and northern regions, and a lot of mental health issues, of course, coming up from that, and people saying that they need mental health supports, particularly with lockdowns and things like that. So I was wondering that, and the minister can answer, others, of course, how might somebody, I guess an Indigenous person living in a remote community go about accessing this app and to maybe help get some access to mental health services that they're having trouble to get?
Great question, Fraser. And as you know, the Wellness Together platform does link people to Hope for Wellness, and Hope for Wellness, as you know, is in Cree, Ojibwe, and Inuktuk. As we go forward, we want to make sure that we can have people access the culturally safe, trauma-informed care that is so necessary in community. But maybe someone from the leadership team could just explain the way forward for this.
Yeah. So one of the things that we are committed to with this consortium is continual refinement and design adaptations, and we really are eager and excited about opportunities to join with communities, including Indigenous communities, to get what we call co-design of this platform up and running. What we know about building culturally sensitive programs is that people like me, Peter Cornish, and others on this panel, while we have some expertise, we want to draw on the expertise of all Canadians, all peoples, and we would be delighted to have people come into this design room with us to help build what is relevant to your community. So it's always evolving. That's the promise. It needs to get better and better. And the experts don't have all the answers, but together as a country, I think all of us together, we can come up with them.
Just to follow up on what Peter was saying, we're always thinking about the accessibility needs of people from coast to coast to coast. And so it's about culturally making sure our services are safe and working, as Peter was talking about. But it's also why there is an app there is a website, people can call, they can text. So we're trying to make that our supports are available in whatever way people are able to reach out in whatever corner of Canada they are in.
Is there anyone else? You're going to have to raise your hand for me to see you. Okay. You can actually have a follow-up question, Fraser. So go ahead.
Yeah, I do have one. Yeah, thank you. So I mean, as it stands today, like it's this I understand the app is being launched. Anybody can access it, of course, from anywhere in Canada, and they could get some of these self-assessments and things like that. But it's evolving, right? And so you'll be updating it and things like that. That's my understanding from your answers. The other thing that I found is interesting, and this is across all Canadians, of course, includes Indigenous Canadians. I found it interesting first the minister's statement that 19 to 29 is the real age group that you're seeing mental health issues with and wanting to access mental health. Is your finding actually, it's kind of maybe a double-edged sword, because I mean, certainly people want to access people in person, right? And in normal times, counselors, things like that. But are you finding that this is really the way young people want to make their first step into the mental health care system, that they want, rather than picking up the phone or going through maybe even the internet or that they want to have an app that they can just hit and get some immediate answers onto some of the questions that they have before pursuing perhaps later supports down the road?
Let me just start, and then maybe Peter will carry on. What we know is, as Peter described, people are browsing and finding what's out there available. But my experience, and I think over the last 15 years, we've seen that young people weren't all that comfortable sitting in a waiting room somewhere and in trying to access their mental health supports. And it was probably 15 years ago that, I mean, in terms of the history of the Kids Help Phone, but even in terms of adolescent medicine, and now we know youth is to 25, 26 in terms of our definitions across the country, that there were programs devised years ago where younger people can do their appointments over the telephone. So you're absolutely right. But I think that it is about what kind of services are the most comfortable. With this app and with this platform, they can get counseling over the telephone or by text 24/7 right away. And so it's not a substitute for counseling, but it is, or that kind of immediate care. But as maybe Peter will explain, what stepped care means is that they're getting the most appropriate care that they're ready for as part of their choices and their volition. So it is an access that we are. I think the evidence will show that just because of the take up of that age group on the website, we are seeing that this is a take up very surprising in terms of people who were really not very comfortable with this way the system was, but also the fact that men have taken this up at almost 40%, which is way higher than the way that men generally access mental health support. So this seems to be reducing stigma and allowing people to feel comfortable asking for help.
I think I would just add to Minister Bennett's comments, Fraser, is that people want both, and it's different things at different times. So what I find working with in the university and college sector is that people are hungry for connection. They'd like to be face to face, but we're not expecting it to go back to where it was before. We're predicting 50% of people might want to be seen in person, and 50% of people would like to see their counselor online. And so the key is to get to give choice. The evidence on outcomes for mental health indicates that preference is one of the biggest drivers, having choices. Now the choice is sometimes too much choice. And we learned this from early, feedback on the use of the portal. There was a little bit too much choice. It was overwhelming. So what we really got to get the sweet spot is choice with some guidance and mental health literacy, giving people the information so that they can make informed choices about what they can expect from this option, this other option, and then perhaps more importantly, what's expected of the people seeking help in order for them to be successful. So that we have navigators on the platform. You can, if you didn't want to talk to a counselor, you can talk to a navigator who can help you to, if you're not sure, if you're overwhelmed by the choice, you can 24/7 connect with somebody that can help you make that choice.
If I can just also jump in from a youth perspective, because we're talking so much about that young adult age group. I mean, we have seen at Kids Help Phone for years that the vast majority of young people who reach out to us, whether it's by phone or by text or by chat, they say that if that had not existed, they would have done nothing else. And so it's not that, they could have gone into a clinic, but they decided to text us. It is that they are using whatever way is most comfortable for them. And for a large percentage of youth into young adults, the thing that they are most comfortable with is that feeling of confidentiality that comes with a call or a text or a chat where they don't physically have to go in. And so that has been a trend we've been seeing for years at Kids Help Phone. And I think we're continuing to see with Wellness Together Canada. And I love this idea you're talking about around choice, Peter, because for some people, absolutely going in and seeing somebody face-to-face is going to be the answer. But that has not been possible through the pandemic. And so what we are trying to develop is something that allows universal access for people, hopefully in the way that they are most comfortable, but at the very least in the way that is safest during this pandemic and as we move forward.
I'd just like to add on, Elisa, that the issue of confidentiality is something that we've heard a great deal about, and particularly in rural and remote communities where people maybe don't feel that whatever they say will remain confidential. And so that there is an advantage to providing this care and support at a distance that they feel safer with than the family doctor that's also their mother's, or the fact that if they go into the clinic, everybody in the waiting room knows they're there. And so, I think that this is the issue of preference that Dr. Cornish has talked about and that Elisa is supporting.
If I could just add one thing to that, Mr. Bennett, I think in our experience, age is one of the determining factors of the modality that gets sought out, for sure. But it's not the only, and we've learned that it can't be the proxy for the reason why a particular person chooses a particular modality, right? We know that we've experienced young folks that absolutely do better because they want to see somebody in person versus, a senior who we make an assumption is not going to want to use an app or a computer, but who is very much in that world. So we just want to make sure, and I think the guiding factor for all the decisions really is how do we meet people where they're at? And I think you said that, Mr. Bennett, in your opening remarks, is making sure that we do that. In as many different ways as we can that are safe and accessible, but not 100% geared. So if you look at the online experience with Wellness Together, it's not geared specifically to youth, and the telephonic is not geared specifically to seniors or more mature people. So we're just trying to create that continuum of experiences that are all safe, that get people where they're at from where they are, or where they want to go from where they are.
Okay, perfect. So we are actually running out of time. So I'm going to get one more question in. Erica, if you can start, please.
Sure, thank you. Hi there, Erica Ibrahim, the Canadian Press. This question is, to be honest, I'm not sure who this would be for, but I know the emphasis being made today is that this will help people through and past the pandemic, given the sort of rates of mental health and substance use being seen during this period. But I was wondering if this will become a permanent suite of mental health options and substance use options funded for Canadians even past the pandemic.
Well, I think everybody on the panel would very much like to say absolutely yes, including me. And it's certainly an ask I have of Minister Freeland, and that we are very keen that we be able to continue this into the new normal, recognizing that again, that the unmet needs of people with mental health and substance use problems pre-existed COVID and was exacerbated during COVID and will stay exacerbated for a while. But there were always those unmet needs that I think needs an ongoing permanent solution and support. So I would very much like to say yes. And just by Erica, I want you to know that I'm on day 4 of the MindWell Take 5 part of the app, and it's way better than the Breathe app that comes in on my phone.
Okay, thank you. Do I get another follow-up?
Yeah, I think Peter wanted to just jump in there a little bit.
Okay, sure.
Well, I was just going to add that part of what we're recognizing is that mental health care worldwide really needs to be transformed. And so Wellness Together Canada has been an exercise in turning some things on its head. And some of this started in Newfoundland with the opening up of their doorways clinics where people could come in and get care. It didn't matter how, whether they were in crisis or not, they could get same day care. And so this is really the start of trying to do something larger and working with provinces and territories and other places in the world to say, can we do mental health better? Because the pandemic has been, it's sometimes a crisis. Of course, it's tragic and there's loss of life and there's lots of struggle, but it's also an opportunity to take a look at how we've been doing things. And for a long time that maybe this is now the time to say, I think we could do a lot better. We could move forward and learn from this struggle. And it can be the impetus to make a major transformation so that mental health is considered as important as health, physical health.
But Peter, I think that you're also, the vision is that this continues to improve, meaning that we will measure outcomes and then adapt and measure outcomes again in that complex adaptive system, so that we want to make sure this is working and that we make the alterations and accommodations as we go forward.
Hi, everyone. Unfortunately, we are quite over time now, so I'm going to have to end it here. But you can reach out to us if you have follow-up questions. Thank you so much.